This program contains content that may not be suitable for viewers under the age of 18. Viewer discretion is advised.
Ruzungu kadera zuku tujikole sawa namba ruzungu.
Ruzungu tujikole namu za kujele kutoka ntoko ndi mbuzi ndi hapo ndi ana bora babaddi abachala wale so muyomba nyembuto katonda ya chembuto genda weji waminge yabawereza buno bukeke obutini
singa babu mutwale bamusonseka mukamwa bwonna nawufulumiza mu nnyindo
kibwa ina guno omugogwa Musa wayitista biblia mu detergent
waliwo wanangabi ebola yakasajja kasendi kalimba bannange sendi bannange.
So listen. Yes, welcome to yet another edition of Kasuku Live. This is Speak to the Doctor. Yes, Iranga tuli wanoko TMR Hospital as usual. And today I'm joined by, it's the first time I've had a urologist.
Yes, sir.
And it's actually the first time I'm meeting one.
I'm humbled.
So how are you, sir?
I'm okay, how are you, sir?
I was like, but getting you is not easy. We've been here like 3 times and they're like, today you're going to work with the Dr. Eladu and the urologist. Then somehow you're busy. Is diseases related to a urologist nyingi nnyo oba?
Zo nyingi, mazima nyingi, but think in the busy nnyo. It's been a bit of scheduling issues naye. Diseases relating to the urology, urology system, ziva kunsigo, kidneys.
Oh, so betugamba a urologist. Maybe for starters, soka we yanjulira abantu bamuzeko.
But the Dr. Bamwesije.
Yes.
Bamwesije Geoffrey, the urologist. And a general surgeon, but kati my practice is mainly urology.
Urology.
Yes,
so when someone atula when they hear urology, chimu breaking it down in simple terms, chiba kitegeeza ki?
So any human being born will have a kidney, will in normal circumstances kidney, the tube that connects the kidney to the bladder where urine is stored, and to exit of the urine. Now that means either girl or boy, man or woman, technically is a potential urology patient. Yes.
So urology deals with the kidney, the
ureter, which is the tube that connects the kidney to the bladder, the prostate for men, and then the urethra.
So how is the situation like these days as relates to that structure?
Kantandikire ku basajja, because I think the people who are, it is what urology is most known for in the community is the prostate.
Yeah.
Especially for older gentlemen.
Yeah. So
let's address that first. Every man born, as long as the anatomy is normal, they have a prostate gland. Katula wansi wakawago, and the urethra goes through it. So, but with age, certain symptoms start to change. More akin to the way changes happen with the uterus for a woman. Yeah, but different biology, but changes start happening with age. So then all along, as people have changes in the way they pass urine, they start complaining. Bw'owulira nti munange yazibikidde bamutaddemu akapira.
Hey,
That is all.
abantu bazibikira.
Yes, sir.
But bw'ozibikira osobola okuddamu
Yes, sir.
akapira n'okavaako.
Nekavaawo.
But the theory we hear about prostate nti evako maybe masturbation, that is 1, 2, taking long without having sex. Is that right?
No. Kati nga bwengezaako pointing out that the biology of the prostate gland changes with age. Yes, so it can increase in size and cause urinary symptoms. Even without increment in size, sometimes there can be changes with the way the mechanisms of it's open, the way the urinary system opens, there can be changes and people start getting challenges. So there's no connection with masturbation. Whether or not you masturbate, you can have challenges with the prostate gland. Yeah.
So we've heard of kidney stones. Let's begin with the kidney. For starters, what does the kidney do in the body?
Well, so let us give it the function of filtration. Let's start with that. So omusayi gujja ne guyita mu kidney and it filters out what is necessary or to keep inside the body. For example, blood stays, and then excess glucose, for example, if someone is diabetic, it will leak out and will be able to catch it in the urine. So basically, let's say it forms urine, which is an information center for a urologist. Because in the urine, we can see blood. In the urine, we can see or chidese mungelia stones, for example. Stones can also give you blood in the urine.
Oh.
Okay. Yeah, so it's the kidney does a very important role. Yeah, for us.
So
that is one of the bigger roles, but there are several. I just mentioned that.
Kidney ke kasengejja.
Katukayitewe katyo.
The sieve in the body. So when things start
kusengejja n'ebirala bisengejja naye kidney naye ina function.
Is one of okay. So kidney stones is usually the disease most people relate to the kidney.
Yes.
When someone says kidney stones, what are kidney stones?
Interestingly, like nga bw'onoolaba akayinja koolonze on the street, that's what the stone can also be like. It can be hard, formed by a kidney, because sometimes, let's say, like in this period, when there's been a drought, sort of very hot, people don't drink enough water, so too much dehydration. That's one of the causes. So those salts which are in the urine being formed, they can easily crystallize. That means forming a stone, and they harden. So when they harden and they keep growing and expanding, then they can form that stone, which is static and is not moving. So the stones can lie anywhere. It can be in the kidney. That stone, if small enough, can move down along the tract, which we already explained. That's the ureter. Then for some people, they can pass out. For others, you cannot pass the stone and you need intervention. And there are different sequences of dealing with them, yeah.
You can end up being operated on.
Absolutely.
So the kidney stones is internal. It is something that's inbuilt.
Bw'ogamba inbuilt kiringa ekyava wazaalibwa nga mwekiri, but it's not.
No munda. Kyezimbira muri munda.
Yes, sir.
Because of poor hydration.
That's one of the issues. There are people who are naturally, like not naturally, but they have the higher propensity to form stones than others. So you find that in certain populations, abamu are forming stones more than others. Those are demographics we can go into, but I don't think it's the scope of our video right now. So, but basically, yes, that's the information. You can form stones which can pass. Sometimes they may impact and they cannot pass, and you need to intervene. So intervention can be done endoscopically. You can do it with other different methods, which if we were to break down here, would be a lengthy discussion. Yeah.
So through that whole system, there is urinary tract infections. Is sifa kuchi?
Kati, let us just say commonly, bacteria are the underlying cause for UTIs, okay? And depending on hygiene, let me first of all say, for example, females have a higher predisposition in certain, because of their anatomy. They have a shorter urethra, the perineal anatomy is different. So obuko bacteria can travel along that path ne buyingira mu bladder. Omuntu gwaba omusulo teguyita bulungi. And for example, the prostate in men, for example, it is possible for them to get an infection along that tract. Yes.
So this thing we hear of omusajja afuka awantu nga si wayonjo n'afunirawo urinary tract infections, is it true?
Your statistic oyo taliyo mu bitabo byetu
ne ku bakazi si kye kimu,
ku bakazi kyanjawulo,
because they say sometimes when you use the dirty toilet, some women don't want to even sit on toilets because they're like, I'll get an infection.
So I'm saying because kati abasajja they have the length of the urethra is a bit is
long
compared to females, which is about 4 centimeters for the ladies. So there's an ease with which the bacteria can translocate along that passage to give them the symptoms of a urinary tract infection, unlike in men. Otherwise, men with age have the propensity for the UTI also because of the symptoms. Enakubuliddeko is a prostate. Nomusulo gutandise okubanga tegutambula bulungi, then they have the chances of getting a UTI higher because one of the issues about stagnation of the urine. Yeah. So
just as a by the way, abantu baffe bwe muwulira infection, most times we say ayinamu ka infection. So olina okwawula UTI ne STI.
Kituufu.
Abantu abasinga bawulira infection aga omwana yalwala dda. Omwana you know, actually like in the beginning I used to hear ngoli baga nti nina infection and I get so worried just to hear someone, you know, has an infection. And they actually people who don't take off cannulas from their hands because they're always treating infections, you know. And we try to tell them maybe, well, originally people were saying she's using dirty undergarments, she's not washing them so well, you know, stuff like that.
Hygiene definitely plays an important role.
For the women?
Yes. But for men also, we need to also keep hygiene. Good hygiene. But more so for the ladies. Yeah. For example, if a man and a woman engaged in intercourse, there's a higher propensity for the lady to get a UTI secondary to the intercourse compared to the guy, to the gentleman. So that is what I mean. There's definitely a role when it comes to the anatomy and the hygiene that has to be kept. Yeah.
So what are those healthy habits that support urinary health?
We mentioned one of the predisposing factors for stones as dehydration. So hydration for the urinary system is a very important thing.
Abantu banywe nnyo amazzi.
Bw'onywa amazzi nga gawera.
Is it true what they say nti amazzi bw'oganywa ga flashing out ebintu?
Ekyo kankiteeke bwenti ne bwenti, quote unquote, naye nga it has a direct correlation. If you have ever observed nti bw'onywa wano saawa zino lita 2 ez'amazzi, within the next 30 minutes ojja kutandika.
Yeah.
So nga bwe twayogedde, the kidney is a filter, so the more volume you load, the more you
and the easier it becomes for it to filter.
So, yes. So if someone is having stones, for example, they have a propensity to form stones, hydration is one of the preventative mechanisms. That is when it comes to urinary tract health. Yeah. Other practice, I won't say best practices, but other things that people should be encouraged to do is for example, because of the capacities of the bladder, nti bw'obanga owulira, for men, let me direct this at men, for example, kubanga abasajja tutera nnyo okwewala okugenda mu ddwaliro, you get symptoms, nosanga nga sometimes someone wants to go past urine, they reach ate basikatiramu, it's not coming as freely as it would have. and never touched Twala as a big deal, or you've gone, immediately you feel like going back, that means that there's a problem with that system somewhere. So another practice that I would encourage is now, for example, men in their 40s and so on, is screening. No gender, no ganjo, why something is not going on right here. And you have to push hard. That can be an issue. Sometimes people hesitate or withhold to go to pass urine. And what that does, it affects the capacity of the bladder to work effectively, because it's also a muscle, it pushes. So when you make it hard, when over time, it kind of, its ability to push weakens. So you don't want to be withholding for long. Those are some of the few things I can quickly point out. But usually the advice would be case-by-case basis.
Yeah, for whatever. Yeah, okay. As we wind up, I just want to talk about the importance of early diagnosis of some of, the issues that may come with the urinary tract and the need for early medical checkups, especially for the men out there. Yes.
Okay, so one, I would first of all emphasize the early checkup or screening should not be looked at as a it is very simple. Like, let's say if you're a man and you're in the 40s, 45, it is good practice to just know basic things. What is your PSA value? That is a screening for the prostate. Look at how your kidney function is. And if you have any of the symptoms, or if there's a family history, then it is imperative that
you come
in and check. And for people who have there's a couple of other issues. There is the issues of dysfunction, erectile dysfunction, pain, and because people have this bit of stigma thing, and yet so I would advise not to see based on age, based on history, or based on symptoms. It is advisable to omuntu agenda mu ddwaliro n'ogamba bannake kino na kino sikitegedde, how best can I, who best can, and usually you end up in the urologist's office.
I know.
Yes, sir.
Yeah, but also people who are watching us, these things of checkups are very, very important, because sometimes you feel the problem, you think chitini, and then ogeno tuke, one in terms of cost, maybe ekyandikuliddeko sente ntini kati ate kigeze, but then even in terms of your own health, especially the men. And the men are so much into self-treatment when it comes to some of these issues, because there's a lot of myth going on about the kidney, about the bladder, about the prostate. And right now there's a lot of drugs on the market. Actually, when you go to public toilets, all companies take prostate, buy this, do this, and they could be right, but are you treating the right thing? Because that's also very important.
Very important.
You need to ask yourself that question. Kyojjanjaba kye kikuluma oba okiraba.
Kubanga mulimu the symptoms ezimu ezifaanana n'olowooza nti the other mugundi agenda ne bamugamba prostate eriko obuzibu, so ng'ate ggwe ekizibu kyokka wago. Different issues.
Bintu byanjawulo. So and like I was talking with someone, fena tulina okwemanyiza to do tests, not just even about the your whole urologic system, but general tests, because you just don't know what is coming your way. There are certain things that just spy out of control.
Right. And
they tend to affect your body. So self-medication should get out of the way, but also coming through here at TMR Hospital, this side of Golden Living, the specialized hospital, you can see Dr. Arthur.
Geoffrey.
Yeah. I don't know why you look like Arthur.
Is it bolder than I am?
Not that, but when I look at you, you look like you're a author or something like that. Yeah. So, but you can come around here, TMR. You ask for Dr. Bamwesije Geoffrey. Yeah. Talk about the kidney, actually the whole system, the urology system.
Yes.
That's what they said. Yeah.
The
Olabe basobola okubeera
system.
muve ku bino ebintu by'emboozi kati ndowooza owulidde bijjo batugamba ebintu ebimu nga bisobola okubeeramuko naye nga not exact. Ate abantu bayise chat GP.
Eyo kati eringa Google on steroids. If I should say it that. Because ekuwa information n'olowooza nti ekintu
kyekyo
naye ng'ate bweba yakutomeza otomerera ddala butadda, which is a problem. But like you said, it's still in the same realm of nti bwemba mumanye ekintu and I need information, I could search for it, but oyina era kyosinga ng'oŋŋamba nti wano okwatawo left. You keep straight here.
Yeah.
And that is the importance of seeking consultation. Yes.
Or seeing a doctor. Kale, tweyanza nnyo Sewa.
Kale.
It's nice. We shall be keeping in touch. We hope to come back here next time to expound more on urology.
We shall be looking forward to be of service. Yeah, urology.
TMR in Yambi. I had never met someone who is a urologist. But you know, even growing up, for us, we would just see a doctor. Kalingaturo was a doctor. Ajanjaba buli kimu. Katubisanze mbukuru waliyo gynecologist naye doctor. Waliyo surgeon abana bakeberebera naye.
Era naye musawo doctor.
So now today I've met a urologist.
Yeah, tuyambiddwa nga abantu beeyongerayo okusoma n'okubeera specialized.
Yeah.
N'osanga nga some few years ago, not very long ago, to see a urologist nga abalina ku ssente, they had to
fly out.
Yes.
But now you're with us.
Now we are here
at TMR.
Yes, sir.
Kale. That's us today. Mubeere bulungi. Mweraba.
The views expressed on Kasuku Live do not reflect those of the host, producers, or management. They are solely of individuals providing them and do not represent or reflect the official policy or position of this YouTube channel.
Abakyala
Wereso omuyomba enyembuto Katonda yekembuto genda wegiwaminge yabaweereza buno bukeeke obutini
singa baabumutwale bamusonseka mu kamwa bwonna n'abufulumiza mu nnyindo.
Kiba alina guno omuggo gwa Musa wayitista bibya mu detergent.
waliwo wanagambye embula y'akasajja kasendi kalimba bannange esendi bannange